36-year-old female. Fraxel, Botox, or something else? Over the last 3 years, my forehead skin has gone from mostly clear to thickened with horizontal creases. I have also struggled with breakouts through my 30s. What would be the best course of treatment for smooth skin? I am open to any lasers, injectables, or treatments.
Thank you for your question. You're 36 years old, you submitted 2 photos, and you stated in your question that approximately 3 years ago, your forehead went from relatively smooth to becoming thicker with deep lines. You also state that throughout your 30s, you've been dealing with chronic breakouts, and you're open to solutions to help you with your forehead lines and your forehead skin, whether it's injectables, lasers, and any other modality. You're looking for some guidance. Well, I can certainly give you some assistance on this question. We deal with this type of issue every day in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can tell you that I've used drugs such as Botox for longer than that period of time, as well as many different injectables, as well as lasers. And so I can give you some perspective on my approach when I meet patients like yourself in our practice. Well, I can also tell you that when you seek opinions, you will get different opinions, because certainly there's more than one way to approach these issues, and every doctor comes from a perspective, some of which can be from experience and others can be from bias based on whatever technologies they currently employ. So I'll tell you this, in our practice we have everything. I'm a cosmetic surgeon, so I generally don't really fall into any situation with bias, because we can do everything from our skincare line, which is non-surgical of course, to injectables, to lasers, to surgery. So to help you understand the situation a little bit better, I want to break it down for you in what I see with the photos. So what do we see? We see forehead lines and we see a lot of acne. Well, to begin with, the forehead lines are essentially referred to as static lines. Static lines are lines that are always there, regardless of movement. And that's in contrast with dynamic lines. Dynamic lines are lines that occur when a muscle is activated. And so the philosophy of dealing with forehead lines proactively, as well as to help soften them in the long term, would be the use of a drug like Botox, Dysport, Xeomin. These are called neurotoxins. What do? They relax the muscles in the forehead so that the forehead does not crease the skin. When you raise your eyebrows, you are constantly creasing your skin. Now, even if you don't raise your eyebrows a lot, it is very common to start seeing these lines form. What do these lines represent? They represent loss of collagen. Basically, loss of collagen in the part of the skin which is the supporting part of the skin called the dermis. So the opportunity is there to do something to help the dermis in a few ways. Number one is to, of course, manage the acne. Managing acne, especially for people in their 30s, is essentially adult acne. There can be certainly hormonal contribution, but as far as treating it from the local skin perspective, there are options, of course, such as topical medications, as well as options that are a little bit more advanced or high-tech. In our practice, we actually have a laser, an ND-YAG laser, that we use to treat inflammation or inflammatory acne. And patients do like treating their acne for a couple of reasons. One is we're able to shorten the lifespan of an inflamed lesion of acne, or as well as effectively we're shrinking the glands and reducing the activity of the oil glands that cause this type of recurrent activity to occur. So a laser does have certain value. Now, of course, this is not always the first line of treatment, but a lot of times it can be integrated with other treatments as well. Topical retinols and other acne-related topicals are always a part of a treatment plan in this respect. Now, when it comes to the other elements of stimulating collagen and stimulating the dermis, you have options such as the use of platelet-rich plasma, which we use a lot in our practice. Platelet-rich plasma is derived from your own blood, and it's a combination of or actually you should say a concentration of the healing and growth factors needed for wound healing. Basically, you're stimulating the body to produce collagen by placing the platelet-rich plasma in the dermis, and that results in improvement in the appearance of lines. Now, in addition, there are also lasers, again, that are non-ablative. That means the top layer of skin remains intact while the collagen in the skin is stimulated. So this is the use of a heat device, but it's using a non-ablative method so that collagen is stimulated. And then last but not least, at a certain point, you can do some type of light laser or fractional laser to help further improve the epidermis and to stimulate and improve the overall skin quality. But of course, that type of procedure is like polishing and improving. And from my perspective, that's one of the last things you do. And again, it's important to strategize in a way so that you don't end up spending a lot and putting yourself through more recovery than you need to. So I think at this point you need to meet with qualified, experienced doctors who can offer you a lot of different options and give you some guidance as to what would be best for you. I can tell you that there is a lot to be said for a maintenance plan. As a surgeon, I used to always very much be resistant to the idea of not fixing something once and for all. But as the technologies and other things have come in and improved, I have been able to, being in practice so long, over 20 years, I've been able to help my patients maintain a certain look by employing things such as PRP and the use of lasers to help, as well as injectables, to help them maintain their look and keep their skin looking good and looking healthy well into their 40s and 50s and beyond. So I hope that was helpful. I wish you the best of luck, and thank you for your question.